Well, it's a new year and time when people resolve to do things they weren't doing, make changes, and set some goals. While you can do most of these resolutions any time of year, a new year is a good reminder to start. In this video, I'm going to go over 5 healthcare resolutions for those on Medicare to maximize your Medicare and your health. Hi, I'm Chris Brang, the Medicare analyst, licensed agent in 14 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be important to you, and my goal is to help people like you make a wise and common decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. If today happens to be your birthday, then a very happy birthday to you. Mark Pickford said, "I was forced to live far beyond my years when just a child. Now I have reversed the order and intend to remain young indefinitely." So 5 healthcare resolutions for 2025. Number 1, review all of your healthcare coverage. If you have a Medicare Advantage plan and made a change during the annual election period or didn't make a change, then review it and use your OEP to make a change if need be. Your open enrollment period runs from January 1st to March 31st, and it's only for those that have a Medicare Advantage plan. When you might need to make a change, you find out a provider is not in the plan's network, you find out your medications aren't covered as well, you have a Medicare Advantage only plan that doesn't cover drugs, and now you need drug coverage. There's definitely another plan that better suits your needs. If you have a Medicare supplement, check your rate and contact me if you are from one of the states I'm licensed in to request a quote to see if you can save money. Now, in most states, you will need to go through medical underwriting to get approved. If you have serious health issues or are just on one wrong medication, then you will likely be declined. To help you out, in the description, I've included links that will show you a typical underwriting questionnaire and a list of declinable conditions. Certain states do have birthday or anniversary rules. That means if you have a Medicare supplement, then at those times you can shop supplements and switch if the premium is low enough. If you have a cancer or critical illness or hospital indemnity policy, review any of those to make sure they are current and still worth having. Do you have or do you need a dental and or vision plan? In most cases, vision plans simply aren't worth it. For dental plans, then you want to make sure your preferred dentist is in the plan's network. If you are not sure, then contact your dentist and ask which insurance they accept as in-network. And do not be surprised if they say none. For most people, a comprehensive plan that covers preventative like cleanings, exams, x-rays, basic dental like extractions and fillings, and comprehensive like crowns and root canals is the way to go. The unfortunate part is most dental plans only cover $1,000 to $2,000 per year. And if you need serious dental work, you are on your own for paying for most of it. It's no wonder so many people go out of the country for expensive dental work. Second resolution. If you are into preventative services, get your annual physical exam, wellness exam, and schedule your routine preventative services. Medicare covers many preventative services like mammograms, colonoscopies, bone mass measurements, numerous cancer screenings, alcohol and tobacco counseling, obesity behavior therapy, depression screening, flu and pneumonia shots. Third resolution. If you don't have an estate plan, get one now. I run into too many seniors that don't have an estate plan, and that ends up causing issues for them and their loved ones down the road. A basic estate plan consists of a power of attorney. Who do you trust to handle your financial and health affairs if and when you can't? A will. Who do you want to get what you have and how? Living will is your life-saving or life-extending wishes should you become terminally ill, brain dead, in a serious accident or medical condition. Do you need a trust? Then you should speak with an estate attorney. Fourth resolution, review your long-term care plan. Do you even have or need a long-term care plan? How will you be taken care of and who will do it down the road? Around 40% of those 65 years old and up will spend some time in a nursing home. There's also a 45 to 70% chance of needing long-term care services. That care could take place in your home or a facility. That care could be part-time or full-time. You typically have 3 options for making sure you are covered should you need long-term care services. 1, it's your very own money. In this case, you set aside funds into an account that is low risk to be used for your care. The average age for someone entering a nursing home is about 83 years old, so you can certainly keep investing and letting your money grow. Speak with a financial advisor about this. 2, consider purchasing long-term care insurance. Unfortunately, while many people could benefit from long-term care insurance, only 14% of seniors actually have a policy. There are 2 basic types of long-term care insurance. The traditional kind is where you pay a premium and you may never ever use it, thus spending lots of money for no benefit. But that is also like car insurance and homeowners insurance. 2 is what's called a hybrid policy, either a life insurance policy with a long-term care rider. If you never need it, then your heirs get the life insurance death benefit, or an annuity with a long-term care benefit that is used to pay for your care. If you have questions about long-term care insurance and you are from one of the states I'm licensed in, then let me know and I or one of my partners will help you with that. 5th resolution, get in shape. It's not too late. It's not as hard as you think. Start with a proper diet. Start by limiting or eliminating what is bad. Processed foods, sugar, sugary drinks, seed oils, alcohol, grains. Consider a ketogenic diet and or intermittent fasting. Of course, speak with your doctor about this, unless your doctor is out of shape themselves. If so, you should probably find another doctor. Exercise. Start with walking more. Do some light stretching and build up to more. Consider paleo squats, what are called dead hangs, wall sitting, HIIT, high intensity interval training, band workouts, water aerobics. Get a good fitness tracker to monitor your steps, your calories burned, and your sleep. Get outdoors more. Next, mindset. Think positive. Avoid negative news and, if necessary, negative people. Meditate and or pray. Read or listen to uplifting books. That's it. 5 healthcare resolutions for 2025. I do hope you found this helpful. If you have any questions about what I've just gone over, and when you are ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I will do my best to answer all of your questions and concerns you may have, and once we determine what is best for your unique needs and budget, I will then enroll you into the plan or the plans of your choice, and of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this video? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.